Hi everybody, my name is Mankaval Sachdev. I'm an interventional endoscopist in the Phoenix, Arizona area, and I'd like to share a method that I have started using to help process my liver biopsy specimens. I belong to a private practice group, and we started doing ambulatory surgical center based procedures about 12 years ago, and one of those procedures was EUS. As part of that evolution of EUS, we started doing FNA, and then ultimately I started adding liver biopsy to our offerings. We do a lot of liver biopsies for elevated liver enzymes, also to check for PBC, and sometimes even in fatty liver. Hepatitis C was one of the other things that we started doing them for initially. We've had good results, done about 80 of them in the last year and a half or two, and had no complications. And I'd like to share how I process them, because oftentimes when you do a liver biopsy, you end up with a bloody mess in the formalin bottle. And I thought it would be a good way to kind of clean out our specimen and make it a little bit easier for the processing portion. So we're going to start here with a video of the left lobe of the liver, and this is one of our patients that we did a biopsy on. And we used the approach at the left lobe of the liver from the gastric body. I used a 19 gauge FNA needle because FNB needles are quite costly, and we have to watch what we spend in an ASC. This needle was primed with heparin, and a wet section method was used, and I did do a slight fanning method, as you can see here. We did about 3 or 4 to and fro thrusts of the needle, and then we prepared to process the specimen. So what I did here was I took a colon polyp trap. This one is made by Microtech. I separated it into 2 pieces, and I discarded the larger part. The smaller part is then attached to a saline syringe, and the reason I do that is it allows me to express water into the trap. I also keep a Q-tip on side, and just in case I need it, I have a needle in case anything gets stuck or we have to pick it off of something. So what we're going to do first is I'm going to basically press the plunger or use the syringe to go down on the plunger, and that will push some saline into the trap, as you see here. I try to create a small pool or a puddle of saline so that I can push the specimen into that and there's not really any splashing going on or anything like that. The tech will then express the needle and then start passing the stylet through that, and you'll start to see blood drip into the puddle, and because blood's heavier, it's going to start to naturally kind of go down to the bottom and actually even enter the syringe. Once I've got the entire specimen out, what I'll do next is I will start to pull the syringe away from the plunger, or if basically pull the plunger out, and that'll aspirate the blood into the syringe. And then I can do that back and forth a few times in order to kind of rinse the specimen. When I'm done, you'll see here that there are yellow cords of liver tissue along the edges, and then we take them out with the Q-tip and put them into this formalin jar. Then after that, we were able to send it off and the pathologist can read it. A couple of comments on that. There are some commercially available filters that you can buy, but they are $20 to $40, and this entire setup just to do it, I mean, the cost of the trap is probably $2 or $3, maybe $5, depending on contracts and whatnot. And obviously saline syringes, you don't even need to use sterile, you can just use water in an empty syringe, but those are very cheap as well. I chose this method because it's cheaper and it's a little bit easier to justify that to your partners in an ASC than spending an extra $20 or $30 on a filter. That's how I do it. If you guys have any questions, please feel free to put those down below in the comments, or tweet me at SuchDaveMD, and I look forward to hearing your comments on it.